Yeah, so this year at ASH, we're presenting data on the first 16 out of 40 patients that are being treated with Pirtobrutinib and Venetoclax. Pirtobrutinib is a non-covalent BTK inhibitor. It's a new generation of BTK inhibitors that seem to be safer and effective in Waldenström's as well. And Venetoclax is a BCL2 inhibitor that already has shown to be effective in patients with Waldenström's. Now, these treatments are very effective. They're oral. They're not chemotherapy, so that's good. But these treatments typically are given indefinitely. So the idea of this study is to give those two agents concurrently. We do have some laboratory data supporting some synergism in terms of killing malignant cells. And by giving them concurrently, we could potentially give this treatment for a couple of years and then do not expose patients to indefinite duration treatment. So this combination is an all-oral, non-chemo, finite therapy. And we are doing this the idea is to enroll 40 patients, previously treated patients with Waldenström's, and the data that we'll be presenting later in this meeting is going to be on these first 16 patients enrolled. Now, the study was designed to try to induce a deep response, and we measure the outcome is a very good partial response, which is in general terms a 90% decrease on the patient's IgM compared to baseline. And this study is trying to show that we can induce at least a 40% very good partial response versus a 10% that will make it less effective. And for that, we need about 40 patients. What I'm presenting in the first 16 patients is we have been able to show that we have at least a 65% very good partial response rate. So this is well beyond of the expectation for a study of this nature. Now, not only the efficacy is important, but also the safety aspects of the combination. We have really not seen any side effect beyond what is expected, either for Venetoclax or for Pirtobrutinib separately. So obviously, we continue enrolling. We are hoping to complete the enrollment for this study sometime in the second half of 2025, and by then, hopefully, we're ready to present more definitive data next year.